This video does a nice job showing how refinements in macular surgical technique as well as surgical visualization with Ingenuity high-resolution 3D surgery really helps us to address what appears to be a fairly pedestrian, but in this case is a difficult surgical problem to fix. This is a young person who's otherwise healthy with a chronic full-thickness macular hole. This person is very motivated to get this repaired and get some return of central vision. With Ingenuity, we see really well to peel the hyaloid as well as the internal limiting membrane. Just previously, we saw how well Ingenuity allows us to get a nice, complete peripheral vitrectomy. Here we're peeling this really sticky internal limiting membrane in a flower petal technique, and we're really trying to reserve all the edges of the membrane to, in this case, prepare a graft and place it in the full thickness macular hole. And one of the things with Ingenuity is we change the color settings to highlight what we're doing. Here we're snipping the edges of the hole, and that color setting really allowed us to highlight the internal limiting membrane peel. Now we're doing a wide angle, changed our color settings. We inject a little bit of liquid under the retina, and here we're cutting off the graft. I think this worked better for us as we weren't traumatizing the underlying RPE and choroid getting the graft in attached retina. We have a chandelier in here, so we're able to bimanually take the forceps and get the graft. Now we're stabilizing the graft with perfluorocarbon liquid, and then we're going to go under high magnification. We've lasered the graft site, and now we're going to take the graft and stuff it into the hole. And once we get it underneath the hole, then we're able to take the internal limiting membrane and pull it up over the graft host interface. We'll add a little bit of laser to the retinotomy site, or the site we use to prepare the graft, and then we add more perfluoron, ultimately do a silicone oil perfluoron exchange, and the patient had nice engraftment with a closed macular hole the first day. Although this is a relatively aggressive surgical approach, the patient is young and motivated. Ingenuity and refinements in macular surgical technique really allowed us to do this case adramatically. Thank you.